Hello, and welcome to our series on using proficiency testing data to improve performance of your molecular laboratory. My name is Dr. Nikoletta Sidiropoulos. I am the medical director of the Genomic Medicine program at the University of Vermont Medical Center, and I'm also a member of the Molecular Oncology Committee at the College of American Pathologists. This particular session focuses on using proficiency testing data to improve the performance of your molecular laboratory. And this is from perspectives from members of the College of American Pathologists Molecular Oncology Committee. These were my disclosures at the time of the original presentation. And so let's get right into it. An oncologist comes to you and asks you about the quality, overall quality in your laboratory. And so you begin to wonder, how can accreditation inspections promote high quality molecular oncology laboratory services? And so the bottom line up front here is understanding patterns of commonly cited laboratory inspection deficiencies can help both laboratories and inspectors ensure preparedness and thereby maximize quality. And so it's in support of continuous quality improvement that the College of American Pathologists Molecular Oncology Committee reviewed data from a recent 2-year period of accreditation inspections and identified the most frequent citations of molecular oncology testing laboratories. This data was published, and the PubMed ID is referenced here for your review. FCAP has an important role in laboratory accreditation as it is deemed a laboratory accreditation organization by CMS. FCAP-accredited laboratories comply with CLIA and meet the needs of patients, physicians, and other healthcare providers by adhering to clinical laboratory practice standards. There are 21 customized accreditation checklists, 3 of which are broad and 18 more subspecialty focused. It's worth defining that a deficiency is non-compliance with a checklist requirement. Phase 1 deficiencies may compromise quality, but do not endanger patients. They require description of corrective action. Phase 2 deficiencies may seriously impact quality, endanger patients, clients, or personnel, or impact regulatory compliance. Phase 2 deficiencies require description of corrective action and supporting documentation. Molecular pathology, when practiced in the clinical laboratory, involves the investigation of nucleic acids in specimens derived from patients to inform clinical care. It is a multifaceted practice and worth clarifying that the data from the study referenced in this presentation is relevant to the oncology subdiscipline, where nucleic acids from patient specimens are used to provide diagnostic, prognostic, and predictive information for clinical care. Data reviewed in this study was derived from de-identified inspection records of 422 laboratories participating in the College of American Pathologists Laboratory Accreditation Program using the molecular pathology and all commons checklists. The most frequent all-common checklist deficiencies most often related to the analytic phase of the testing workflow. If you think about the testing workflow in terms of a pre-analytic, analytic, and post-analytic workflow. Most of the deficiencies here were defined as phase 2 deficiencies. And the most common citation was maintenance of the laboratory activity menu. This is a phase 1 deficiency categorized as a pre-analytic activity and was cited in 7.8% of participating laboratories. This inspection requirement informs meaningful oversight as it is used to, number 1, monitor PT performance, and number 2, inform the proper use of specialty checklists during inspection. 4 deficiencies were related to proficiency testing from the all-common checklist. The most frequent molecular pathology checklist deficiencies were more evenly distributed across all phases of the testing workflow, pre-analytic, analytic, and post-analytic. Less commonly here were phase 2 deficiencies. The most common citation was inadequate studies performed to validate analytical accuracy. This particular citation and item is related to laboratory developed tests or modified FDA cleared and or approved tests. It is specifically due to inadequate number and or type of specimens used during validation. It's a phase 2 deficiency categorized as a pre-analytic activity and was cited in 9% of participating laboratories. There were 3 additional common citations related to the validation, quality management, and system update management of bioinformatics pipelines used in NGS-based testing. So there are opportunities for laboratories to improve compliance and molecular oncology testing quality based on the data and observations that arose from this study. Certainly, efforts to maintain an accurate activity menu at all times is worthwhile. And you can do this by ensuring personnel that are responsible for updating the activity menu, that they are knowledgeable about the testing that's actively being performed in the laboratory. Also, for them to establish a regular review schedule. Lastly, in terms of this particular item, incorporating reminders for activity menu updates into procedures used for implementation or retirement of tests, instruments, and or methods can be very, very useful. Next, performing adequate validation studies for analytical accuracy. The appropriate number and type of validation samples is dependent on the test, its intended use, and the methodology used. And so documenting criteria used to determine sample size of a validation study with valid justification for the decision is important and can be very useful during an inspection process. Next, analytical specificity of modified assays. If any modifications are made to an FDA cleared or approved test, a full validation must be performed rather than a verification of performance, and that is important to remember. Also worth mentioning is that there were a significant number of commonly cited deficiencies that may be positively impacted by implementing a modernized electronic lab information system. It can help with things like reagent expiration, the availability of properly versioned procedure manuals at the bench, tracking, maintaining, and documenting semi-annual alternative performance assessments. So very useful. And then another major opportunity for labs is first of all, recognizing that proficiency testing is a hallmark of best practices in pathology and laboratory medicine. Remember that laboratories are required to participate in appropriate CAP-accepted PT for patient testing performed. Semi-annual alternative performance assessments may be required as determined by careful evaluation of your activity menu to determine which tests you're performing require enrollment in a CAP-accepted PT and which then may need alternative assessment. All unacceptable PT results require evaluation with documented corrective action. The College of American Pathologists provides guidance and resources, including forms and worksheets for proficiency testing and alternative assessment on its website. So that can be very useful for laboratories. Also, there's a requirement to document histologic assessment of neoplastic cell content from formalin-fixed paraffin-embedded tumor specimens, from which nucleic acid is extracted for molecular analysis. The College of American Pathologists Molecular Oncology Committee oversees an educational neoplastic cellularity PT survey that is intended to support best practice. And so in conclusion, the College of American Pathologists inspection process is focused on 1, continuous quality improvement, 2, consultation, 3, collaboration, and 4, and very importantly, bidirectional education. Understanding the most frequently cited deficiencies can help both laboratories and inspectors ensure their preparedness and thereby maximize quality. As we wrap up, I want to let you know that there is a molecular oncology topic center available on the College of American Pathologists website, cap.org, cap.org. This topic center is a repository of peer-reviewed publications and resources on the topic of molecular oncology testing, including some of the lessons learned from proficiency testing. Thank you.